President Trump predicting Democrats and Republicans will eventually come together on a new health care plan. This after the tax reform measure he signed into law Friday eliminates Obamacare's individual mandate, which requires everyone buy health insurance or pay a penalty. The president tweeting, quote, based on the fact that the very unfair and unpopular individual mandate has been terminated as part of our tax cut bill, which essentially repeals over time Obamacare, the Democrats and Republicans will eventually come together and develop a great new health care plan. Let's bring in our panel. John Loudon is a former Republican member of the Missouri State Senate. Adam Hodge, former communications director for the DNC. Thank you, gentlemen, and good morning to you.
Had a Merry Christmas.
Good to be with you.
All right. So originally, Republicans were supposed to tackle health care first. That flopped. So then they went to tax reform second. It was supposed to be the other way around. John, how will Republicans go about doing so in 2018?
Well, look, we are stimulating the economy with tax cuts, with deregulation, and one of the biggest 800-pound gorillas in the room is Obamacare. We're all happy about repealing the individual mandate, but don't forget, Obamacare has individual mandate, employer mandates, and all kinds of regulations on what plans can look like. It is inherently a package of regulations limiting the availability of health insurance in this country. Your policy has to look like this. It must include that. It can't disallow this. And it's a mess. It's a set of regulations that needs to be repealed and control handed back to the states.
Yeah, I mean, in place of health care not passing in 2017, I mean, Republicans, you have to give it to them because they did manage to repeal the individual mandate in the new tax law, which was that was one of the biggest bones of contention when it came to forcing American people to buy a product that they didn't want to have to buy unless, and if they didn't, they would be penalized and have to pay a fee. Adam, Mitch McConnell told NPR.
And employers.
Yeah, and it's not fair. I mean, what kind of country do we live in? But the question is, you know, whether or not they want to all agree on moving forward on repealing and replacing Obamacare, because McConnell, Adam, told NPR on Thursday that he thinks that the Senate will, quote, move on to other issues instead of trying for repeal and replace in 2018. But then you've got several top conservatives in the House, including the president, whose tweet I just read, making it clear they do want another shot at it. And I mean, come January, people's premiums are going to skyrocket, and Washington cannot ignore that.
Well, I think you have to remember that Obamacare is more popular now than it's ever been. We've seen record signups during the open enrollment period that the Trump administration actually cut funding for and shortened the enrollment period. So, again, Obamacare is more popular than ever. And you've heard not just Mitch McConnell, but you also heard last week Senator Lindsey Graham from South Carolina saying he didn't think that it made sense to go forward with another attempt to repeal and replace Obamacare. The attempts early this year to gut this law have actually emboldened members of my party. You've seen more and more people signing up to run for office, and that's what's leading to this huge wave of enthusiasm and momentum that's going to lead to a really strong performance from Democrats next year.
John, I mean, would you say that Obamacare is more successful now because there are no other options? Why the increase, would you argue, for the uptick in Obamacare? Because a lot of people that are currently signed up for it and didn't just recently sign up for it are dreading those premiums that are about to hit them come the new year.
Well, you know, it's funny. Democrats love government. I wish they'd love state government a little more. Why do they love the federal government control? Why not hand it back to the states and let state government control it? That's closer to the people. That's where it ought to be controlled. But the federal one-size-fits-all has left people with less coverage, less access to health care. If you have an Obamacare plan with a if you have an Obamacare plan with a $7,000 deductible, you have no health care at all. It is the form of health care without the substance of health care. California, the state I just left, has fully embraced Obamacare, and they fall in the bottom 25% of states for total access to health care. People have coverage, but they can't access it, either because the deductibles are too high or because the doctors aren't available. People wait in lines longer than they wait in Canada or the VA in California to get health care. So
that's just more of the same scareball tactics that you've seen.
$2,000 a month. But, Adam, I mean, some people are paying $2,000 a month for health care. Does that seem fair?
Well, would you rather that people were going into the emergency room?
No, I'd rather affordable health care. That's what I'd rather.
As would I, and I think what you've seen is people getting access to life-saving treatment.
So then why shouldn't we fix it?
I think that there are Democrats and Republicans have an ability, and there are policies on both sides that actually would repeal some of the, sorry, not repeal, that would actually improve the law, strengthen the law. And that's what I think the American people want to see their members in Congress and the leaders in Washington actually try to do, to strengthen the law and make it a more effective law. But again, we're not going to start by taking away health care from 13 million people, which is what happened in the repeal of the individual mandate. We know that's unpopular.
Right.
You're going to see a premium spike of another 10% for people who already have their coverage, but that's not stopping people from signing up.
A lot of people are actually not signing up or not having health care because they're no longer mandated to. So millions of people that didn't necessarily want to be.
We should live in a country where more people have health care.
Electing not to be anymore,
right?
So it's not taking their health care away. But
no, but people who have insurance are going to lose their premiums are going to spike, and they're going to lose their coverage. And that's life-saving treatment. That's cancer treatment. That's treatment for kidney issues. That is the America we live in.
All right, we have to go. I'm sorry, I've gotten around.
Always
from
a pleasure.
Producer Adam Hodge, John Loudon. Thank you both.
Thank you for having me.